Hi everyone, Connor Muss here with Warm Heart Counseling. I want to talk today a little bit about CBT, cognitive behavioral therapy, and also about why it's so popular, why you may have heard of it, and also some criticisms I have of it as well. So cognitive behavioral therapy is a tool within therapy that I do utilize as well in my practice. Um, and it stands for cognitive behavioral therapy, and the approach is all about addressing the cognitive aspects of yourself. So the basic idea is by changing your thoughts, by changing the way you think about things, you can change your behavior, hence cognitive behavioral. And so there's a big emphasis on the thought aspect, on noticing thought patterns, coming up with tools to change your thought patterns when you notice them going in a certain direction, and as a result, changing behaviors that you don't like or changing bad behaviors through changing how you think about them. And CBT is an extremely popular type of therapy. I noticed that lots of new people to therapy tend to ask for CBT specifically. And maybe if you're new to therapy, maybe you know what CBT is, even though you don't, or you've heard of CBT, even though you might not know specifically what it is or what it does. And I think that the reason that CBT is so popular or is such a big name in the therapy world is exactly because of that second word in CBT, which is behavioral. When people do studies on therapy and on effectiveness, it's a lot easier to measure behavior changes than it is to measure, say, emotional or somatic or transpersonal shifts in your psychology. So when you focus in on something that changes behavior, it's a lot easier to build a scientific backing for because it's a lot easier to measure. You may have heard this term evidence-based. Evidence-based psychotherapy is psychotherapy that's been studied in a scientific way as a way to prove its effectiveness. And CBT, because it's behavioral, behavior, which is an external measure, can be much easier measured. And so there's a lot more studies about CBT and its effectiveness. As a result, I think CBT is suggested a lot by physicians. It's suggested a lot by people who don't know too much about therapy, but they want something that they know is going to be effective. And I think this is great. I think that CBT can be extremely helpful in some cases. If you're struggling with specific negative thought patterns or specific negative behaviors that you want to shift, CBT can be really effective at targeting those specific behaviors and specific thoughts and shifting them slightly. But I also want to talk about why I think that CBT is not the end-all be-all of therapy, and why, if you're brand new to therapy and you've heard of CBT, you should consider opening the horizon on other types of therapy as well. The fact is that an evidence-based psychotherapy, the fact is that all psychotherapy is evidence-based. There is evidence that psychotherapy is effective. There's evidence that engaging in therapy provides positive outcomes in people's lives predictably. And so I think this reliance on an over-scientific, evidence-based treatment approach can kind of actually undercut some of the ways in which therapy is the most effective. So the way that I look at therapy is I don't just think of the cognitive aspect. The cognitive aspect is one aspect of your being, your thoughts, what's going on in your head. But I think that CBT and therefore purely cognitive or behavioral approaches kind of miss out on the larger picture of who a person is. The fact is that there's a lot more going on in yourself and your motivations and your life than just what's going on in your head. There is the emotional realm. What is going on in your emotions? How do the emotions affect you on a day-to-day level? There's what's going on the somatic realm or the body realm. How are certain emotions or experiences affecting your body, and where are you holding tension in relation to these experiences? There is the realm of trauma. How have past experiences been so painful that they've lodged themselves in a stuck way in your body, in your behavior, and in your emotions? And then there's the larger picture of the holistic picture of yourself as a whole being, not even divided down into these different parts. And how do you, as a human, not as a brain, not just as the thoughts or the actions you make, but how do you as a whole being navigate your life and make good decisions and move towards mental health or health in general? All of these dimensions are not really captured by CBT because CBT focuses exclusively on cognition and behavior. And so while I think CBT is extremely effective in some areas, and I do utilize it as a smaller part of a larger treatment plan, I think an over-reliance on a behavioral or cognitive approach might miss the larger picture. And I think that because CBT is so easily measured because it deals in cognition and behavior, I think that there's a supremacy of a cognitive and behavioral approach when people think about what effective therapy looks like. And so no physician will really send a client out for depth healing or trauma healing or somatic psychotherapy. Generally, therapy that's recommended, therapy that's referred out to in conjunction with psychiatric help or in conjunction with work with a doctor is generally people recommend a purely cognitive approach. And like I say, I think that misses out on the larger picture. So there are a lot of ways in which I think that cognition is actually the result of much deeper lodged issues or problems in people's lives. So you might notice the thought problem of feeling anxious or thinking depressive thoughts, or the action problem of not exercising or having suicidal thoughts or making negative, not helpful moves in your life. But if you only look at the cognition, you miss what might be going on in the deeper picture. So a more holistic, depth-oriented approach looks at why are these thoughts coming up in the first place? What's happened in the childhood that causes certain patterns of being to develop? Where have there been traumas where there's stuck pain or stuck experience in the body that you can't seem to move past? What's happening on a physiological nervous system level that's causing hyperventilation in association with anxiety, or that's causing a low energy or low mood in association with depression? So looking below the surface, you can see that there's seeds to these cognitive aspects of yourself that are coming out. And I really think that a holistic or depth-oriented approach can be more effective in the long run to weed out from the root what's happening in these areas of your life. So I think for myself, a hybrid or holistic approach is most helpful. Having CBT as a tool to affect the thoughts, to affect the behavior as needed, but also looking underneath to what might be going on at the root, at the core, and why these behaviors might be there in the first place. And I do think that any one approach without the other is a little incomplete. And that's why I advocate for a more holistic approach. I think that CBT, in the context of a larger picture approach to what's happening in your whole system, is much more effective than focusing in narrowly on the thoughts and on the behaviors to try to shift those specifically. And the fact is that this is backed by, this is evidence-based too. you don't think of a holistic or a depth-oriented approach as so evidence-based, because these things are hard to measure. It's hard to measure trauma healing. It's hard to measure, you know, releasing old hurts from your childhood. But the fact is that recent studies and studies not so recently as well consistently have shown that there are positive outcomes in therapy, but that they don't depend as much on the specific modality. A recent study by the APA, the American Psychological Association, as well as prior studies on the same topic, they did a meta-analysis, which is taking data from multiple different research studies and compiling them to get a meta view or a bigger picture view on specific outcomes in therapy, have consistently shown that the factors that lead to successful therapy are not the clinician's theoretical orientation or even their experience level or training. The factors that consistently lead to effective outcomes in these studies are all about the relationship. So if a therapist and client feel very collaborative, if there's a strong consensus together, cohesion, if they feel empathized with, and if they feel a positive regard, both that the client feels positively regarded by the therapist and the client has positive regard for the therapist, and overall the alliance or connection that a client or patient feels with their therapist, those are the factors that lead in these studies that lead to the most successful outcomes. So I think rather than focusing on which is the best modality or which is the best approach or which is the most scientifically backed therapeutic orientation, I think instead the most helpful approach to take is noticing, who do I feel most comfortable talking with? Because as I've said, the evidence shows that the research shows that having a positive relationship and positive rapport with your therapist is much more important. If you really think about what this means, it's kind of mind-blowing, because this means that a brand new therapist right out of school with very little training, seeing their first client ever, may have much better outcomes with their client than a 40-year experienced PhD with decades of practice under their belt and dozens of trainings, who's at the top of their field, expertise in scientifically evidence-based backed treatment modalities. The brand new therapist can actually have better outcomes if the relationship and the quality of the alliance is strong. So I think there's such an emphasis on evidence-based treatment. There's such an emphasis on finding specifically a CBT therapist or an EMDR therapist, or finding someone with decades of experience, or finding someone with a PhD. And while some of those things can provide reassurance to us, I think the number one factor, like I've talked about, is that connection. So I think, and I've seen that the trick or the best way to assure positive outcomes in your therapy is to talk to a couple of different therapists and choose the one who you feel the best connection with. Choose the one who you feel, I could form a genuine connection with this person. I could form, although it's a professional relationship, I could achieve a real and impactful relationship with this person. And that, more than any specific treatment modality, is going to lead to the best outcomes. So I hope you find this helpful. I think this is an important topic because I know how difficult it is to reach out for help. And it can be easy to want to rely on specific letters or specific years of experience to feel assured. And I think it's important to really tune into yourself and talk to a couple of therapists and feel who you feel the best alliance with. And so I hope this is helpful in you choosing the right therapist for you. Finding a good therapist who you feel a connection with can be life-changing. And I really wish for you that you find someone who can provide that for you. not just who has the right letters behind their name. So that's what I have to say. I hope you find this helpful, and I wish you all the best. I will see you all next time. Take care.